What is diabetes? Diabetes is a long-term condition that affects how your body uses glucose or sugar. Because glucose is required for energy production when it is not available from food, the body will turn to other sources such as fat stores. If not treated, this can lead to long-term health problems. Diabetes is a disease in which your body either cannot produce insulin or cannot use the insulin that it does produce properly. Diabetes is difficult to live with no matter what type you have or where you are in your journey. Insulin is a hormone that your pancreas produces. Insulin's function is to control the amount of glucose sugar in the blood. To ensure that the body functions properly, blood sugar levels must be carefully monitored. Too much blood sugar can be dangerous. Excess blood sugar can harm organs, blood vessels, and nerves. In order to use sugar for energy, your body also requires insulin. Type 1 diabetes, also known as insulin-dependent diabetes, is an autoimmune disease. People with type 1 diabetes are unable to produce their own insulin and thus cannot regulate their blood sugar. Type 1 diabetes usually appears in childhood or adolescence, but it can appear in adulthood as well. Type 2. People with type 2 diabetes can't use the insulin their bodies produce properly, or their bodies can't produce enough insulin. Type 2 diabetes is most commonly diagnosed in adults, but it can also develop in children. Type 2 diabetes can sometimes be managed with just a healthy diet and regular exercise, but it may also necessitate medication or insulin therapy. Diabetes during pregnancy. Gestational diabetes can occur during pregnancy if your body is unable to produce enough insulin to adapt to the effects of a growing baby and changing hormone levels. Essentially, the cells become resistant to insulin action, and as a result, the pancreas is unable to secrete enough insulin to counteract the effect of these hormones. This causes hyperglycemia, high blood sugar levels, at first, and then diabetes. Prediabetes is a condition in which blood sugar levels are higher than normal, but not high enough to be diagnosed with type 2 diabetes. Although not everyone with prediabetes develops type 2 diabetes, a large number of people do. It's critical to know if you have prediabetes, because studies have shown that some long-term complications associated with diabetes, such as heart disease, can begin during this stage. How can diabetes be diagnosed? Diabetes is a condition in which the body's ability to control the amount of sugar in the blood is impaired. Diabetes is a serious condition that can result in heart disease, stroke, blindness, kidney failure, and death. Diabetes can be diagnosed in a variety of ways. The most common method is to take blood sugar levels. Diabetes, on the other hand, can be diagnosed based on symptoms. If you experience any of the following symptoms, consult your doctor: hypertension, high blood pressure, heart issues, diabetes pre-existing, a weight gain of more than 10 pounds in the previous year, excessive urination. If you exhibit any of these symptoms and your blood sugar levels are higher than a certain level, your doctor may diagnose you with diabetes. Diabetes symptoms. Diabetes symptoms usually appear gradually over time, but they can also appear suddenly. Many people with diabetes do not exhibit any symptoms at first. Diabetes symptoms include 1. Extreme thirst or hunger. 2. Extreme exhaustion. 3. Passing urine more frequently than usual. 4. Muscle ache or weakness. 5. Vision issues. Causes of diabetes. Diabetes is a condition in which the body is unable to produce or use insulin properly. Insulin regulates blood sugar levels by transporting glucose from the bloodstream into cells to be used for energy. Diabetes can be caused by a variety of factors, the most common of which is obesity. Excess weight raises your BMI, body mass index, which raises your chances of developing type 2 diabetes. Genetics, age, and race, ethnicity are all factors that can increase your risk. Consult your doctor if you suspect you have diabetes. Your doctor can use several tests to diagnose diabetes, including a blood test called fasting plasma glucose (FPG) or hemoglobin A1C, HbA1c, If you have diabetes and are not taking diabetes medication, your doctor may recommend lifestyle changes such as diet and exercise. Diabetes is a chronic disease characterized by high levels of blood sugar, glucose. Glucose is the primary source of energy for human body cells. This means that in order to control diabetes, you must maintain a healthy lifestyle. Eating a healthy diet is one of the most important factors in avoiding diabetes. It is recommended that you limit your intake of foods and beverages high in sugar, calories, and fat in order to avoid developing diabetes. Regular exercise has numerous advantages, one of which is that it keeps the body from developing diabetes. Regular exercise can help the body use the insulin hormone more effectively, allowing for better blood sugar control. Diabetes is a natural body condition in which blood sugar or glucose levels increase.